Morning, everyone. I'm so delighted to welcome you here today to our first ever virtual Talks and Tables event. My name is Brooke Bosma. I'm the Chief Development Officer at St. Paul's Foundation, and I'm here in the office at St. Paul's Foundation coming to you live. It's a privilege to be here today on the unceded territory of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh peoples. And I'm happy to be here today and so delighted that so many of you have joined us. It's, normally, as you know, Talks and Tables is an event that takes place at Bandu's and Gardens, and it's been there for the last 5 years. Of course, you can wander from table to table and speak with experts and listen to different topics. And obviously today's a little different. We find ourselves in the midst of a global pandemic. And so we appreciate your ability and willingness to come along and hear these important remarks virtually. In some ways, it's a little bit more convenient, but in many ways, it's more difficult without that interpersonal connection and relationship. So thank you so much for being with us today. Let's jump right in to a few housekeeping notes. There's two things you should know. The webinar is being recorded. Now, what that means is that only people like myself and the speakers will be recorded. You are not being recorded, and nothing that you are not on the screen. So no worries about that, but it's important to know that you will be muted. So if you have to get up and answer the door for a courier or your dog starts barking, that's no worries. You'll be staying on mute the entire time. And also a reminder that when you registered, it allowed us at St. Paul's Foundation to send you emails, reminders, updates for this event and for other things that might be coming up in the future. If you ever want to unsubscribe, just click the bottom of that email and hit unsubscribe, and you can do it at any time. Okay. So this morning's session will be divided into two different sessions, and we'll have a short break in between. We'll all need to get up and refill our coffee or tea, and then settle back in for a panel discussion on the second half. Each of the two sessions that we're going to do are followed by a question and answer, and we invite you to submit your questions. The way that you do that is you click on the chat box. It's either at the bottom or the top of your screen, depending on what kind of device that you're using. So I encourage you to explore that screen and find that chat button. And there will be some Q&As, and I'll be able to moderate those Q&As when we get to the end. There's not a ton of time, and so I encourage you to submit those Q&As in real time. As you're hearing things being presented, go ahead and submit those. You can vote on other people's questions as well to move them up. So if somebody's already asked a question that you're interested in, just click a thumbs up on that and it'll get higher in the list. And it's possible that we won't get through all the questions. It's an important topic we're covering today. So if that's the case, please submit the questions back to the email through which you registered, and we'll do our best at St. Paul's Foundation to connect you with the right person for those answers. So we expect to finish at about 11:45, and we will wrap up with a draw for our raffle, $50 to a restaurant gift certificate donated by our amazing and generous friends at Vancouver is Awesome. So I wanted to kick things off by introducing Michelle Bati, Director of Sales at Vancouver is Awesome and publisher of the Vancouver Courier. Please take it away, Michelle.
Thank you, Brooke. Good morning, everybody. Welcome to Talks and Tables. This is our 8th seniors event that we put on, but our first virtual one. And it's being brought to you by Vancouver is Awesome in partnership with the St. Paul's Foundation and our presenting sponsor, Legacy Senior Living. It's with deep appreciation, I think, St. Paul's Foundation and all the kind, hardworking hearts that go into putting on an event like this, especially when we have to move it to a virtual platform. We've been working with them for over 5 years, and it's truly a partnership we are very, very proud of. And of course, I want to thank our presenting sponsor, Legacy Senior Living, a leader in retirement living in Vancouver, for seeing the value in this event and coming on board to ensure that we can do this event free of charge for all of you. And thank you to all of you for attending. For some of you, you might be new to Zoom, so thanks for coming on board, and we hope you thoroughly enjoyed the event.
Thanks so much, Michelle. We really appreciate your support over the last number of years and getting the word out about these events and the talks and tables, so thank you. It was former First Lady Rosalind Carter who once said that there are 4 types of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. With more than 70,000 British Columbians living with dementia, most living in their own homes and being cared for loved ones who haven't received any special training, the question is, who will take care of those who care? Who will care for the caregivers? At St. Paul's, we're answering that question with our Dementia Caregiver Resilience Program, the Lower Mainland's first formal program of support to build caregivers' skills, stress coping abilities, and mental well-being. Dr. Liz Drance is a geriatric psychiatrist, and in addition to caring for patients with dementia-related behaviors, she's supported both of her parents through their dementia journeys. For the last 2 years, she has been a part of the team caring for the dementia caregivers at St. Paul's Hospital. Karen Gilbert is an occupational therapist at St. Paul's Elder Care Clinic, where she supports older adults and their caregivers in activities that are meaningful to them. She has a special interest in cognitive rehabilitation and is passionate about empowering caregivers with knowledge, skills, and habits to foster resilience. We are so pleased and so honored to have Dr. Liz Drance and Karen Gilbert with us today. I remind you, please submit your questions as we go along. There's no need to wait for the end, and I will pass it over to you, Liz and Karen.
I want to thank you, Brooke, for that very kind introduction. And I want to thank St. Paul's Hospital Foundation and Vancouver is awesome for the opportunity to be part of this webinar and to be part of Talks and Tables. So Karen and I want to welcome you. I want to welcome all the viewers as we explore the needs of dementia caregivers and share a bit about our work at St. Paul's Hospital in the Dementia Caregiver Resilience Program. And we're just working to get that first slide up. So resilience, what is resilience? It's the capacity to bend with the wind, to go with the flow, and to bounce back from adversity. And that's a quote from Linda Graham, who's done a lot of work in resilience. And as you and I all know, that life is filled with unanticipated experiences and challenges are coping. Resilience is about how we approach situations that we didn't ask for, and how we get up from the ground each time we fall off the horse, which we all do almost daily. COVID-19 has been a huge lesson for all of us. We've been dealing with uncertainty and difficulty with respect to our fear of becoming ill, perhaps being ill, the isolation that has arisen, the financial challenges we've been dealing with. And resilience is our ability to adapt and learn new ways of doing things, and while honoring the emotions that are part of the process. So it's being able to bounce back and to honor that things are also difficult when they are so. Okay, so Brooke, you stole our fire. There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So regardless of which of these 4 groups you currently see yourself as part of, life serves us wild ups and downs. It's part of being alive. And the question for all of us to explore is, what's in our resilience toolbox? So for family members living with dementia, their challenges warrant a robust toolbox because things are constantly evolving and changing. So they have to be able to hold on to their connection with their family member as they are now, while perhaps grieving the changes in their relationship as they knew it, and the reality that life is not going to look the way they had imagined it would. So resilience can be developed by building our inner resources. And that's our focus in working with dementia caregivers, building their already present inner resources. So just to touch on what is dementia, just a reminder that dementia is an umbrella term for a set of symptoms that are caused by disorders affecting the brain. So it can be caused by 80 to 90 different kinds of illnesses that actually cause dementia, but the common ones I've listed here: Alzheimer's disease, Lewy body dementia, vascular dementia, frontotemporal dementia, sometimes mixed dementias, and the all-important reversible dementias, such as depression or medical illnesses that can masquerade as dementia. So dementia is the umbrella term, and really important to know what kind of dementia we're talking about. So dementia is much more than a memory disorder. Each illness causes a dementia that looks slightly different. And the illness can affect our ability to learn new things, as well as to remember, our ability to plan, to initiate activities, to make judgments about things. It can affect our ability to express ourselves verbally and to understand language. And it can affect our ability to do multi-step tasks like driving, dressing, cooking. It can also affect our ability to appreciate the consequences of our behavior. So you can see it's a complex illness. It affects many parts of our ability to connect with day-to-day life.
So we also wanted to share a definition of caregiving, just so people have an idea of what we mean by that term. And this definition by Schultz, it really speaks to the experience of many of the people that we work with. So the provision of extraordinary care exceeding the bounds of what is normative or usual in family relationships. Caregiving typically involves a significant expenditure of time, energy, and money over potentially long periods of time. It involves tasks that may be unpleasant and uncomfortable and are psychologically stressful and physically exhausting. So the people we work with, they do not have formal training and often didn't anticipate being in a care partner role. So this definition really highlights the challenges of caregiving. Can there be positive experiences in caregiving? Absolutely. But even for those who have a positive experience overall, this level of extraordinary care is also a reality. And also just to note that you'll hear us use two terms interchangeably: caregivers and also care partners, meaning the person with cognitive change and also the person who's close to them providing support. So who's providing dementia care in Canada? About 46% are spouses, 44% are adult children, and of those two groups, about 43% of those people are working full-time. The majority are female. They live in the same household as the person with the cognitive change, and they're providing daily care. And overall, the numbers of caregivers is rising as the number of people living with dementia is steadily increasing. And this is really due to the growth in Canada's senior population, which is expected to rise 68% over the next 20 years. I had to go back and double check that I had that stat correctly because it's such a staggering number, but that was the correct number. So many of the statistics that you'll hear really highlight seniors, but I think it's also important to note the unique challenges for people who are less than 65, who are also living with dementia, as this illness can occur and have an early onset. So the research also shows that unpaid caregivers of seniors with dementia put in more hours and experience higher levels of distress than those providing care for other seniors. So building resilience for this role is very much warranted.
So what makes supporting a family member with dementia so challenging? Well, there are four general areas. As I mentioned earlier, some of the disease-related issues, the types of symptoms that people are experiencing, the duration of the illness, that it is years, as Karen mentioned, the intensity of the support needs that arise when you're caring for someone with cognitive change, particularly in the middle and later stages of the illness, And the variability day to day and the unpredictability of change. So it's this notion that there is constant change and we have to be able to roll with it. And the emotional and the behavioral consequences of the illness for the person living with the illness often have implications for the caregiver as well. In terms of caregiver issues, as Karen mentioned, we're not particularly prepared for such a demanding experience. There is the experience of dealing with ambiguous grief, meaning the person is still with us, but they're changing. And so we have to be able to deal with that as we go. And then the demands on our own emotional resources, which can often be made more taxing if someone's had a previous mental health challenge, such as depression or anxiety. So the caregiver experience can also be colored by the pre-existing nature of the relationship. So if there's been long-standing interpersonal conflict, for instance, that can make the situation much more complex and more demanding. And finally, the practical challenges. So the demands on time, the sense of isolation that family members tell us they feel, and the financial and work-related challenges, which, as Karen mentioned, are particularly relevant when we're talking about caregivers who are children of people living with dementia or spouses of people living with early onset illness. So how does dementia caregiver distress show up? Well, when family members are significantly distressed, it has effects on their physical and emotional well-being. The more complex the care partnering situation, the more likely it is that it will take a toll on the caregiver's well-being. So in terms of physical illness, we can see increases in stress-related symptoms, changes in sleep, fatigue, and then increased blood pressure, headache, chest pain, worsening of diabetes, GI symptoms. It can have some pretty significant effects. And in terms of psychological symptoms, we can see anxiety or depression, the overuse of substances or overeating to compensate or to avoid the feelings that go with it. We see people often lose sight of their own well-being in their attempts to keep their family member well. And according to the Canadian Institute for Health Information, more than 4 out of 10 caregivers of people living with dementia identify themselves as experiencing significant distress, almost twice as many compared to caregivers of seniors without dementia. And 21% feel at times unable to continue their caregiving activities, as compared to 12% for people who are caring for an older adult without cognitive change.
So Dr. Drance's comment there really summarized, looks at that we end up with 2 identified patients instead of 1 in those situations. So there was a really interesting study done by Most and colleagues in 2017 that looked at healthcare utilization for people with dementia in emergency departments and inpatient admissions. And they looked specifically at people who were experiencing dementia-related behaviors, such as delusions or hallucinations or agitation and aggression. And what they found was that it wasn't the dementia-related behaviors that led to hospitalizations in many of the situations. It was actually the caregiver distress that resulted from the behaviors that led to these emergency department visits. So the study concluded that identifying these patient-caregiver dyads or pairs that were high risk in terms of their distress was especially important and required understanding the needs of both the person with the dementia and their family caregivers. So they recommended investment in programs that teach caregivers strategies to manage challenging behaviors. And research has shown that these programs need to incorporate practical knowledge, skills in communication, skills in self-care, and skills in emotional regulation. So the study that Most did, Most and colleagues, concluded that effectively identifying, educating, and supporting distressed caregivers may help to reduce patient costs and the overall healthcare expenditures. So as a healthcare system, we really need to support caregivers to build resilient skills rather than only focusing on treatments or medications to prevent the person with dementia from requiring hospitalization. So Dr. Drance and I we were seeing this scenario happening with the people that we were working with. So we were meeting people that were in these more complex situations that led to higher levels of distress and who could benefit from a more individualized approach to building resilience. So as you heard at the beginning of the presentation, in my role as an occupational therapist, I work with many people experiencing mild cognitive impairment and also early dementia. So I'm often meeting people earlier in the experience of cognitive change, and their family and their spouses, or the people that support them. So we really work to enable the person to optimize their functioning and engage in what matters most to them. And as the illness progresses, the care partner also becomes somebody that I'm providing suggestions and strategies to. So in the past, the interventions that we've provided to caregivers were largely in service to the health and functioning of the person with dementia. We didn't really have a formalized way to offer individualized care to these caregivers. So when Dr. Drance approached our team in about 2016 about developing a service that was specifically for caregivers, the need and benefit to the people I work with was so apparent.
So, and much of my work has been in supporting people living with marked dementia-related behaviors. And throughout my career, I've really recognized the challenges that families experienced and the ways that their distress was actually worsening the whole situation, both for themselves and for the person with the illness. So for these complex situations, a different level of caregiver support was needed. And I was fortunate enough to encounter some really innovative care approaches in the form of the CARES program and mindfulness-based dementia care that you'll hear a little bit about in a few slides. And we were able to, through the support at St. Paul's Hospital, to develop our Dementia Caregiver Resilience Program and to support people with complex needs. So who is part of that team? There is our social worker, Karen, who's the occupational therapist, and we have geriatric psychiatry as part of the team. And while it may sound quite grand, we are a small but very passionate group who work very part-time. So we are able, at this time, we've been really careful in who we've been able to support because our resources have been very limited, but we're really excited about the work we've been doing. So the Dementia Caregiver Resilience Program really provides care to the family member directly, as Karen mentioned, rather than off the side of the patient's chart. So when they come to us and they're referred by their family physicians, when it's been identified that they are needing sort of more complex support or more than support than a community support group can offer, they are then referred to us, and we focus on skill building and coping strategies. So we're very focused on being able to support people to build the skills that they need to do the work of caregiving. And our goal is to improve the quality of life for both care partners, through the individualized support of the caregiver. So by supporting the caregiver, we support their well-being and the well-being of the person who's living with cognitive impairment. And as Karen mentioned, we really want to minimize the occurrence where we end up with 2 patients instead of 1.
So this diagram has a lot of information on it, and it's not to scale, but it really represents where our program is situated. So we're a small part of the elder care clinic at St. Paul's Hospital. And as you've heard, our team not only works with caregivers, but also the person with dementia. And we work with them together. So we develop relationships with the dyad or the couple, the family. So we're positioned to identify when a change has occurred that requires a different type of support, either for the person with dementia or the caregiver. So it's really an ideal setting with wraparound services and access to a full interdisciplinary team that we can support care partners throughout the spectrum of the illness and partner with and connect people with a range of community-based services. So organizations like the Alzheimer's Society, there's some amazing support groups out there, community care, home support work, respite care, and also the in-clinic resources with our specialist physicians and our interdisciplinary team. So as Dr. Drance mentioned, the Dementia Caregiver Resilience Program, our focus is really on skill building to increase resilience and reduce potential risks for caregivers. So those are things like lack of knowledge, lack of awareness of strategies and resources, and confidence in caregiving skills. So we were fortunate enough to connect also with the Reitman Center for Alzheimer's Support and Training at Mount Sinai Hospital in Toronto, and do some training with them in something called the CARES program that they developed. And so they've identified these 4 key elements to successful caregiving that really form the foundation of our program. So practical and professional support and resources, knowledge of the disease and treatment, effective caregiving and problem-solving skills, and emotional well-being.
So in terms of our services, we do a lot of our work in groups. We run a program called the CARES program, which focuses on problem-solving techniques and on communication skills that are actually built through the involvement of a simulated patient. And they help caregivers to sort of explore communication strategies in real time. And it's a very, this was the program developed at the Reitman Center at the Mount Sinai Hospital. And we've been very fortunate to be trained in that program. We also provide mindfulness-based dementia care, being the first site in Canada to do that. It's an 8-week course that offers instruction in mindfulness meditation and mindful communication strategies. We also work individually with people who either a group doesn't work for them particularly well, and we focus there on skill building, connecting them with appropriate community resources for their changing needs, and specifically counseling and psychotherapy. Sorry, go ahead, Karen.
I was just going to say, with COVID-19, it has really, really led us all to draw upon our resilience to cope these past number of months. And people with dementia and their caregivers have experienced the loss of access to some really essential services that just can't be replaced virtually. So things like closures of adult day programs in community centers, reduced home support, fears of allowing home support workers into homes. So there's really been a lack of respite, a lack of restorative activities or access to those interpersonal connections that are so important for everyone's well-being. People have been separated from family members in long-term care for months. And everyone knows how sheltering in place together for long periods of time can lead to increased tensions, but particularly when you're at home and you're providing care. So people who were already in very highly stressful situations found themselves, when COVID started, with an even higher level of distress due to the situation. So our team really hit the ground running, as many people did, moving our caregiver groups online, offering support by phone or by Zoom for individual sessions. And we ramped up the care that we were providing people in their homes. So through virtual methods, obviously. So we started offering weekly meditation sessions for alumni of our mindfulness-based dementia care. And we've now facilitated our very first entirely online new program of mindfulness-based dementia care. And we also created a CARES Refresher series for the alumni of that group to support the ongoing integration of skills that had been learned in previous groups to support people to cope during this really challenging time. So we've learned a lot from participants during this time, and really how valuable the opportunity to revisit the educational and skill building components of the program at different stages of the illness can be. So I think I can confidently say that virtual care will remain a part of our offerings, regardless of what happens with COVID in the future. It's been really well received and has really allowed people to attend that might not otherwise have been able. So when we first meet caregivers, when they come to our program, they're often telling us about the challenges that they're experiencing and their feelings of overwhelm or feeling lost, burnt out, isolation with their fears and challenges, a loss of sense of control, exhaustion, dealing with changing behaviors, difficulty translating knowledge into action, grief, loneliness, and a loss of sense of themselves. So just by looking at this slide, you get a sense of how really overwhelming this experience can be. So based on each person's needs, we connect them with the group or the individual service that's the best fit for them at the time, and offer different options as new needs emerge. So these programs, they don't make all of these, these struggles go away, but they really support people to have the capacity to, with Dr. Drance's definition she shared at the beginning, to bend with the wind, go with the flow, and bounce back from adversity. So it supports people to be resilient and throughout the different stages of dementia caregiving.
So just to cover some of the risks to caregiver well-being and what it looks like as we build resilience, as Karen mentioned, people come in with, they don't feel confident in their caregiving abilities. They struggle and they often feel overwhelmed. And through developing their skills in communication and self-regulation, they actually feel more equipped and more confident that they can manage, and they also know how and when to ask for help in the future when things change. One of the things that happens is people come in with a somewhat limited understanding of dementia, not because they haven't had great education, but because sometimes it's hard to apply that education into action, to actually understand how the knowledge around dementia looks in their particular care partner. So we work to deepen that understanding and help them translate knowledge into action. A major risk for psychological symptoms and the development of anxiety and depression or unhelpful coping strategies is when people feel overwhelmed by their emotions. So we use mindfulness strategies and other in-the-moment tools to support caregivers to recognize, name, and provide space for their emotions. And this allows them to often develop some distance from their feelings and to be able to work with them rather than to feel drowned by them. People, when there are strained interactions between care partners, that is a real risk to well-being for both of them, as I mentioned in the beginning. And through the use of simulations in the CARES program, where caregivers are able to rework stressful situations, and through mindful communication practices, we see a reduction in the tension between partners and a greater sense of understanding and patience on the part of the caregivers.
And so most of us have been socialized to use self-criticism as a motivator. So when we struggle, we think that being hard on ourselves will help us improve the situation or our performance. But the research shows that it's actually self-compassion, and being kind and nurturing to ourselves, just like we would to a dear friend that was struggling, is what allows us to be more resilient during difficult times. So this is a key skill that we support both caregivers, and actually I use this with people with early cognitive impairment as well, to practice in their daily lives. And I just want to note, as we're talking about this point, that during the development of the program at St. Paul's, we've really been fortunate to build close partnerships with groups like Vancouver Coastal Health and the Alzheimer's Society, and expand the support that we're able to offer dementia caregivers. And so for anyone who's interested, there's a wonderful opportunity coming up. Dr. Drance is actually leading 2 webinars, one on mindfulness and the other on self-compassion, hosted by the Alzheimer's Society. So if you're interested in that, you might want to pop over to their website sometime in the near future to register so you can learn more. And just to point out another risk of distress in dementia caregiving is exhaustion, and that sense of hopelessness. So learning about a variety of self-care strategies, as well as remaining open to possibility during this really challenging experience, is also really key to caregiver resilience. So growth is possible while we're providing care, and we have the opportunity to witness this regularly with the people that we work with. We also see that people can put a lot of energy into trying to control the situation. And dementia caregiving, it involves a lot of grief work. So allowing emotions to surface, accepting the changes that will come, and learning to stop trying to control the uncontrollable, which can add a great deal of suffering to an already very painful situation, is another skill that people learn during the program. There's a risk of caregiver distress in not recognizing the unmet needs of the caregiver and the person with dementia. So it's important to be recognizing and making space for one's own needs. The priority can often become providing care for the person with dementia. So it's really essential that people learn to identify and honor their own needs as well, whether those are emotional, physical, or social needs. So in the programs, we really support people to have a look at what's in their resilience toolbox and learn some new strategies that they can add in if that's what's going to be supportive for them. So we wanted to take some time at this point in our presentation just to have you reflect a bit on what's in your own resilience toolbox. Regardless of whether you're impacted personally by dementia at this time, we can all look at our resilience toolbox to see what's working for us and whether there are any new tools and strategies we might like to add to better cope with life's unanticipated experiences as we all are coping with right now in the midst of COVID. So self-care is not selfish, it's essential. So this is really a mantra in our programs. It's essential for everyone, but particularly when you're dealing with the complexities of caregiving. So your own well-being and the person you're caring for really depend on it. So we encourage you to consider what activities might feel restorative to you. It might be something that seems small and simple, but regularly doing activities that allow us to feel fulfilled, rested, or give us a sense of calm or groundedness can really help sustain our resilience. And another mantra we talk about often in our programs is put on your own oxygen mask first. So just like when we're on an airplane and we're instructed to put on our own oxygen mask before helping others, taking care of your own well-being is really the first step to resilience as a caregiver. This is not optional. And again, I think often having that recognition and giving ourselves permission to be able to take care of ourselves can be a really important skill that people add to their toolbox. So through both the CARES and the mindfulness groups, people add relational skills to their toolboxes. So dementia leads to shifts in well-established communication patterns between people and communication approaches that had led to predictable outcomes in the past. They can no longer work. So care partners are often needing to pay attention to subtleties like tone of voice, how many words they use, addressing emotions instead of getting into rationalizing, which may lead to overwhelm for the person with dementia. So we often talk about this idea of connect, don't correct. So this is a very important skill in dementia caregiving because even when the areas of the brain that do higher level thinking have declined, the parts of the brain that tell us whether we're safe or whether we're in danger still respond really well. So starting off an interaction with a moment of calm or connection instead of rushed energy or a critical comment can really shift the trajectory of the interaction and what happens next.
So one of the key strategies in supporting people with dementia that we teach is to learn the art of pausing. So slowing interactions down, coming out of our heads. As Karen mentioned, we're often rushing around before we interact with our families. And when we actually slow down, come into the moment that we're actually in, instead of disappearing into our stories and beliefs that usually run the show, it can really transform the relationships and interactions. So that's mindfulness, being fully aware in the present moment of what's actually happening without judgment and with kindness. Mindfulness practices help us to think less about life and help us more to engage with life. And so we learn to recognize the thoughts that get us into trouble and learn ways to relate to these and to life with more ease. So yeah, so that's one of our key foci, key focuses. So the other and sort of final one that we'd like to sort of message that we'd like to leave you with is we really work to help people experience the this and So learning to hold that this is a painful and challenging experience, but that they can also, I can do this. So even though this is difficult, I can do this, I can experience joy, I can experience growth, and I can hold both of these complex experiences at the same time. So we work a lot on this and. So that's just a whirlwind sort of introduction to care for the dementia caregiver. And we just like to share with you a little bit about our vision for the future. We would love to be able to develop different groups and services, even more innovation to allow more flexibility and a range of supports. We're really interested in looking at interventions that support the dyad or the partnership together at the same time. Currently, our programs are somewhat separated. We really want to maintain and grow, as Karen said, the online and telehealth options for group interventions locally and around the province, so that care partners requiring our level of service, regardless of location, could have access to individualized support. And we really are looking forward to building a robust research component into this program to demonstrate the effectiveness of these interventions in moving the dementia care support strategy forward. So that was a whirlwind. Karen and I would really like to thank you for being with us as we've introduced the needs of dementia caregivers to you and some of the innovative strategies that we have the privilege of working with and supporting caregivers as they develop their resilience their resilience toolbox. And with COVID-19 coloring all of our experiences, it's really useful to explore your own resilience toolbox and see what inner resources you want to grow on the road ahead. So we thank you for being with us today, and we look forward to some questions in the time remaining.
Thank you so much, Liz and Karen. It's wonderful to hear your reflections, hear your concepts, and hear your expertise in this important subject. And we all face it. I myself have a parent that I help to care for. And so we all relate to these things in different ways. It's been interesting to watch the questions pop up. So we do have a number of questions. I do encourage everyone on the call now to now go to that Q&A button, either at the bottom or at the top of your screen, and click on that and look at the questions that are there and highlight the ones you would like answered, or add your own. There was one question that came in during the talk that was about making this available to the general public. So we will be sharing the presentation with everyone who's on the call on the Zoom today. So we'll follow up with each of you, and you'll be able to get these slides and this presentation for your own analysis and introspection after the fact. So first question to go to. My friend is caring for a patient with dementia, and I want to be supportive, but I don't know how. I'm afraid of saying or doing the wrong thing. What are some ways that I can be helpful and support this person? So maybe I'll pass it to you, Dr. Drance, first, and maybe you can give us some advice and insight on that question.
Well, it's such a wonderful question, and I'm really grateful to the person who put it forward, because one thing that family members do tell us, as well as people who are living with cognitive change, they tell us that friends do disappear, and you've just actually shared with us the exact reason why most friends disappear. It's because we're not necessarily comfortable, or we don't necessarily know how to be helpful and supportive in those situations. So one of the first things, and I really encourage you to explore a bit more about dementia and what it is and how to be helpful. And the Alzheimer's Society does also share wonderful educational programs online, and really will help to understand what's actually going on in the brain. Because when you understand that, it's not as frightening as or worrying. We can connect more. The other thing to do is just simply to ask, how can I be helpful? That's the big thing, is that we're all people. People are people, and to to feel encouraged that you can just step forward and say, I just really want to be supportive to you. What is it you both need, and how can I be there for you? Karen, any other thoughts on that?
Yeah, I absolutely agree with asking the question, because I think, yeah, when we're able to put that question to the person that's struggling, often people have something really clear, and it might be something bigger, it might be something small, but at least they can let you know what it is that they're needing at that particular time, because it might change over time too, depending on where things are at.
And it's a real expression of your care for them, and that's what people genuinely appreciate as well.
Great, thank you. So even just asking that question of what I can do, how I can help is an important, just a first step to start that conversation. Another question that a lot of people are interested in. My mother has always been a very independent woman, but she started showing significant signs of cognitive decline. She still insists on doing everything alone, but I worry about letting her do things like going on long walks all by herself. How do I help her still feel empowered to be independent, but also keep her safe?
Go ahead, Karen. It's one of your bailiwicks.
Thank you. That's, again, such an excellent question, and it's such a balance to support people and also allow them to have their independence and their autonomy. So one of the lessons actually that I've learned over time is that when people are able to make decisions for themselves, they have the right to live at risk. So I think often as family members, we want to hover and keep them safe, right? We want to do everything we can to keep somebody safe. But we often don't have ultimate control over that. So I think separating ourselves from feeling like it's our responsibility in order to keep someone safe 100% of the time can be important. And then there's also lots of things that we can do. I mean, technology is so helpful right now in terms of that particular question with, going out for walks. And it would depend on what the safety issue is there. Is it a risk of falling, or is it a risk of getting lost? So it would, be looking at the particular experience of that person in terms of what might be, what we might suggest in order to improve their safety. Did you want to add to that, Dr. Drance?
I think the only thing I'd just like to add is what you've pointed out there, though, is what's the underlying need that the person is wanting to meet through their going out for long walks? Is it the desire for autonomy? And so how can one support that? And as Karen says, it's always a balance. And what other things could they be needing? So as an exercise, sometimes inviting them to help you to do something by going out for a walk. It's different when the person is really feeling as though they're doing something useful and helping you, as opposed to you hovering along just to make sure they're safe. So exploring different ways of supporting people, yes, to feel and to make decisions for themselves. Yeah.
One thing I would encourage everyone on the call to do as well is to just look up some of the work that Providence is doing currently in Comox. We have partnered with the ministry there and are looking at opening Canada's first publicly funded dementia village, which takes some of these concepts and tries to put them into action in a physical way. So if you're interested more in that, I encourage you to Google that or look on our website to find out more information about that project that's coming up. Okay, next question. From your experience, how has COVID impacted caring for persons with dementia? How has this impacted caregivers, especially if they're working from home now?
You want to take that one, Dr. Drance?
Sure. So one of the challenges in supporting somebody who has cognitive change, who's living through COVID, is the change in the resources that are available to support them. So people who've had lovely structured weeks where they knew what they could look forward to and were really engaged have actually lost those opportunities, at least in the short term. As everything's gone online, that doesn't necessarily work for people who have cognitive change, although it could, depends on who they are. Again, all of these answers are very individualized, but we do recognize that it has caused a lot more distress for both the person living with cognitive change and their partner. One of the things if you're caring for someone in the later stages of their illness is even managing things like continuous hand washing and making sure you don't get too close to people is a challenge. And again, it's another one of those situations where we work hard to always balance, and try and find ways of supporting the person to be safe, but also recognizing we are not going to be able to do it perfectly. So yes, and it's been quite demanding for people who work out of home and who are caring for a family member who's living with cognitive change, who's actually with them a lot of the time. And so that becomes, self-care strategies become even more important. Yeah.
Next question is a good one, and it's just practical. Can you share any, quick mindfulness strategies or practices with us right now?
So we have a few minutes. Karen, did you want to share the stop practice?
Sure, I'm happy to share the stop practice. I wonder, we had a slide on this actually. I wonder if I should attempt
But I don't think you need it because it doesn't say anything on it. I think you can just do it.
We'll just talk you through it then. You can picture a stop sign on the screen right now. So this is a practice that we use often with the caregivers in our program, and it's a strategy that any of us can use anytime that we're feeling a bit overwhelmed, or we're feeling kind of stuck in our head, or we're feeling unsure about what we should do next. So it's called the stop practice, and the S, the T, the O, and the P each stand for a step. So I'll invite you to try this out with me as I talk you through it. So find a comfortable position. You're likely sitting already. Feel your feet on the ground. Might feel your buttocks in the chair. If you're comfortable, you can close your eyes or just have a receptive gaze at a point in front of you. And the first step of the stop practice is simply to stop. So the S stands for stop and pause. So if you've been watching this webinar and taking notes, set down your pen and simply come into the moment and be present. The P stands for take a few deep breaths and pay attention to each breath as if it were a new experience. So really noticing the sensation of the inhale and a long exhale. And the O is for observe. And we're going to observe three things: our body sensations, our emotions, and our thoughts. So we're not trying to make any of them go away. We're just recognizing what's there. If there's a particular thought that continually goes through our mind, if there's an emotion that's present in this moment, so naming that emotion, whether it's distraction or worry or excitement. And then also just checking in with the body. Is there any sensation that you notice right now? Might be where you're holding tension, might be a tingling, might be a tightness somewhere. And the P is to ask the question, or the P is to proceed by asking the question: what is most important to pay attention to right now? And the answer to that will be different for everyone that's watching this webinar, and it will be different depending on when you ask the question. So if you're feeling particularly stressed in a moment, it might be take a few more deep breaths. or it may be go get a glass of water, or call a friend, or go for a walk. So it allows us to tap into what we need and what's most important for us in that particular moment.
Thank you,
So I
Karen.
invite you to open your eyes and come back into our virtual space together here.
And just to say that stop practice, people who are part of our program tell us it's probably the most useful, quick in the moment practice for when things are going off the rails. And it is the practice that helps create that sacred pause, whereby that prefrontal cortex of ours, that problem solving part of the brain, comes back online and helps us to make wise decisions, as opposed to us reacting out of our emotions and our conditioned ways of responding.
Mm-hmm. Thank you for that. We don't have much time left, so I'm going to have to cut it down to just 2 questions left, and then we'll be taking a short break. So here's another specific question. My mother has dementia and currently is in a care facility being cared for and living. However, my father has decided to stay in their home. He's now showing signs of cognitive decline. He is very frail and receives home care support daily, but as a family, how do we support his decision? So Dr. Drance, any advice on that?
Well, it's always interesting when we are trying to support somebody who is making a decision and we're not certain how it's going to go, or we're not going to certain, which goes back to the things we can't necessarily control. And I guess the question is always, we need to keep an eye out for how's the person doing? What is it they actually are needing? Sometimes, as Karen mentioned earlier, it's our concern about keeping the person safe, when in fact the person is doing adequately. So sometimes we have to allow people to live at risk. If it's a question of, how much support are you able to provide the individual versus, you feel like it's getting too much for you as a family. It's a hard question to get specific about without knowing more, which is actually the whole point. Is, you meet one person who's living with dementia, you've met one person who's living with dementia. And so while we can give you some general guidelines, we really have to know a lot of specifics about the situation to give you wise counsel. So I'm going to leave that one a bit vague. Karen, did you want to say anything specific?
Yeah, I second your comment about that. I think in those situations, there's so many factors and variables that it's one that if you haven't had support around that already, it may be worth having a referral to a geriatric clinic, so that you can connect with an interdisciplinary team that would be able to really, kind of look at all the factors that are involved and help you kind of unpack what might be a really complex situation. So it's an excellent question, though.
Okay, and we'll end with this one for today. My father has been very independent, but is starting to mess up with his finances. What shall I do to try and help him?
Well, the first thing is to recognize, as you said, that he's always been very independent. And so however we're going to start to approach the conversations with him, we're going to be very aware of that, and very aware that this is somebody who's probably not going to cope well with our immediate saying, you're starting to mess up with your finances, Dad. It's time we stepped in and did something. So tend to try and use factual information to start with. I mean, if this person is just now developing some early cognitive change, if you're finding bills haven't been paid, or or there are situations where it's coming to your attention, to be able to bring that to his attention and just ask him, you know, if he's aware of that, because he may actually be aware and be too embarrassed to ask for support. On the other hand, he may have no insight into it. And again, it will depend also on the level of financial complexity that he's dealing with as to how quickly you have to rush in and support the situation. So again, it's a question that requires more information, but the key is to start gently, right? And to start from a position of curiosity rather than I know better and I'm going to tell you how to do it, because I can guarantee your dad will not appreciate that one right off the bat. Karen, any thoughts?
I'll just add, there's lots of really practical ways to, again, depending on the individual situation and where the difficulty is coming up, to support someone to be as independent as possible. So yeah, there's people that can look at that and analyze the situation and help to support the person that's having the difficulty to remain as independent as possible, and then also connect with resources should further supports be needed. So yeah, I've got all these ideas going through my head right now of things that, you know, that may be helpful, but yeah, again, I would say seek individual advice around that, because I think that can be really helpful.
And Karen, that actually reminds me too that it's important to clarify what the difficulties are that your dad is having. So that would be a time to suggest that it would be good to see his family doctor, which is the first place to stop in terms of diagnosing cognitive change, and to begin to understand what's causing the difficulties once they're pointed out, rather than just assuming that this is the umbrella of dementia. As we've said, there's lots of medical causes or medication causes that could be causing his difficulties. So an assessment of what's going on is probably the first step, if you can get him to get there.
Okay. Unfortunately, there are some great questions, but we're gonna leave it there. If you do have other questions that weren't answered, please feel free to contact us here at the Foundation through that email that you received the invite and everything else. We will be sending also a follow-up email, so perhaps wait for that and then respond to that with further questions. I just wanted to say thank you, Liz, thank you, Karen, for your expertise and your time this morning and sharing with us. We're so grateful for it. We're going to take a short break. We'll be back at 10:45. So, you know, maybe go through that stop practice one more time. Take a stretch, stand up, bio break, coffee, tea, and we'll see you back here in about 10 minutes at 10:45. Okay, thanks so much, everybody.
Thanks so much
Thank
for
you.
having us.
Bye-bye.